제가 보내주신 영상을 봤습니다. 영상에 보니까 누워있을 때 증상이 심했는데 밤이든 낮이든 누울 때는 그런 증상이 생깁니까?
Well, no, only when she goes to sleep or relaxing, then the symptom happens. But when she walks around, it doesn't happen. When she lay down, while she's sleeping, it's gone.
낮에도 누우면 그런 증상이 있습니까?
Yes.
잠을 자지 않더라도?
Every time when she lays down, relaxing. Yes. When she walks around, it's okay. When she lays down, it happens. When she sleeps, then she. But when she walks around, she still have pain inside. But she can. It seems like her move. Yes, it's controlled. Yes, but it's paining. It's in pain.
이런 증상이 언제부터 생겼습니까?
The first time in September, about it only lasts about a week.
1 week
Yes.
ก็เดือน10
And then it happens again on the next month, on October.
ตอนนั้น10 days
About 10 more days.
แล้วก็หายไป
And then it was
เดือน
and then it was gone.
แล้วก็เดือน12ก็เป็นอีกทีก็
อะไรนะ
ก็
เป็นหัวใช่ไหม
แม่งานอันที่2ก็เป็นอีกทีหนึ่งก็ประมาณ10 วัน
Okay, and then one more time in December. 10 more days. Around 10 more days.
ก็หายไปแล้วก็มาเดือน5ที่ไป
And
เซ็น
then
ปอ
and then
คอ
yes, and then a long pause
ไม่
until
เป็นเลย
until May of this year. Until
Okay
she went to diagnose and they put up the neck brace on her, and then it came back strongly.
แล้วก็เป็นระยะ3 เดือน
Yes, and then the past 3 months, ever since then, she's been having it back.
그러니까요.
Yeah, it's like a bone doctor, and they thought she needs a neck brace, like the accident one.
그걸 왜 했습니까?
The doctor took an X-ray and he said the bone in the neck is deteriorated, it's weak.
week
Yeah, so they put it to strengthen it up. But after 5 days of putting it on, she has a pain much worse, and then the dystonia symptom comes back. She starts shaking.
이걸 벌리거나 닫을 때 턱에서 소리도 납니까? 턱에 통증도 있고요. 언제부터 있었습니까?
First, last September, they said
last September
it was even worse than. Seems like right now she's used to it more. First time in September, it was when she opened it was sharp pain in this.
그럼 눈이 자주 건조하고 눈이 통증이 있다 했는데 이건 언제부터 있습니까?
This past month.
어깨, 등, 허리 통증은 주로 디스토니아 오기 전에도 있었습니까?
After.
엉치, 허벅지 뻣뻣하고 자주 아프다. 무릎 관절이 자주 아프다. 발목 잘 뛴다. 허리 삐끗한 병이 있다. 이거는 언제부터 주로 있던 증상입니까?
Ever since the neck, because around 2 months, 3 months. Past 2-3 months, yes.
this year right?
Yeah, this year.
2 months
Yeah, about 2-3 months.
잠은 잘 주무시는지?
She needs medicine.
sleeping pills right?
Yes.
복부에 별도 움직임이 따로 또 있습니까?
right?
Yes.
근위 환자는 잠들기 1시간 전에 먹는다고 했지?
Half an hour.
약을 모두 잠자기 전에 저런 경련이 계속 생깁니까?
She moves, but the medicine will help not to have so much pain in the next morning or after she has this symptom.
지금도 누워 계시면 저렇게 움직이겠네요?
Yeah, I think she can see it right now too.
C1, C2, C3, C4가 오른쪽으로 심하게 디스토션 돼 있고
네.
확 뭉쳐 있습니다. 이게 이 장치를 착용해서 양쪽을 똑같이 정상 공간을 만들어 보는 겁니다. 그러면 이 장치는 문 상태로 누워서 잠시
But she
보겠습니다.
feels that right now the movement is much less.
강도가 아까 10개만큼 심했으면
네.
10개가 줄어들죠.
A lot. She said. She said from compared to before, 60% less. That's around there.
40 left.
Yeah,
옆으로도 한번
60 to 70. That's what she said.
60%에서 70%.
This side gone even 80% never. About 80% gone on this side.
이것만 가지고도 치료가 될 수 있다는 것이 예측해 볼 수 있는 겁니다.
Yes. Thank you very much.
Right. Okay. Yeah. 오셔서 처음 치료받아 보셨는데 기분이 어떠십니까?
Better. The legs, even the legs is better. The neck, the back is no pain also. Legs, back, no pain.
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin-yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the blood channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the atlas C1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease, and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as a main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposable custom-made intraoral balancing appliance which allows balance of TMJ at the optimal free weight space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of patients.